Hello, my name is Thomas Olson. I'm an Associate Professor of Medicine and Science at Mayo Clinic in Rochester, Minnesota. I'd like to share with you the findings of a study we recently published in Mayo Clinic Proceedings entitled High Intensity Interval Training in Cardiac Rehabilitation: Impact on Fat Mass in Myocardial Infarction Patients. It is well known that obesity is a major risk factor for the development of cardiovascular disease. However, traditional measures of body mass or body mass index do not take into account the quantity of fat mass relative to total mass. And this is important because evidence suggests that total body fat, and more specifically abdominal fat, are independent risk factors for long-term cardiovascular events and mortality in patients with, and even those without, known coronary heart disease. Exercise training as part of a comprehensive cardiac rehabilitation program is a critical component of guideline-directed secondary prevention for patients with myocardial infarction. However, there is no universal agreement on the most effective exercise prescription to improve body composition and fat distribution for patients with established coronary heart disease. Traditional moderate intensity continuous training is the most common form of exercise training used in cardiac rehabilitation. And this form of training has demonstrated efficacy at attenuating weight gain in patients who are overweight or obese. Interestingly, a few recent studies have shown that high-intensity interval training may be more effective at improving cardiovascular disease risk factors, including subcutaneous and abdominal fat mass in otherwise healthy but overweight or obese individuals. The purpose of our study was to compare the efficacy of high-intensity interval training versus moderate-intensity continuous training on body composition and adipose distribution in patients undergoing cardiac rehabilitation after a myocardial infarction. This was a retrospective review of consecutive patients who enrolled in cardiac rehabilitation after myocardial infarction at Mayo Clinic in Rochester, Minnesota. Of a total 391 myocardial infarction patients identified, 120 of these patients completed all 36 prescribed cardiac rehabilitation sessions and completed dual energy X-ray absorptiometry, or DEXA, for measurement of body composition at both pre- and post-cardiac rehabilitation time points. Of these 120 patients, 30 patients engaged in moderate-intensity continuous training and 90 patients engaged in high-intensity interval training. What we found was that the patients who participated in the high-intensity interval training exercised at a higher average exercise intensity based on calculated metabolic equivalence. They exercised for a longer duration and expended more calories during the exercise sessions. These differences likely contributed to the significant improvements we found in total body fat mass, total body fat percentage, and abdominal fat percentage in the HIT group compared to the moderate intensity continuous training group. With these findings, the high-intensity interval training group also demonstrated significantly greater reductions in total cholesterol, low-density lipoprotein cholesterol, and triglycerides. However, after conducting a subgroup analysis of patients who were matched for differences in exercise intensity, exercise duration, and energy expenditure per session, we found that these patients in the high-intensity interval training group continue to demonstrate significantly greater reductions in total body fat mass, total body fat percentage, and abdominal fat percentage. Additionally, the greater reduction in total cholesterol and LDL cholesterol in the high-intensity interval training group also remained significantly different despite no differences in statin therapy intensity between the groups. Thus, the main findings of our study suggest that myocardial infarction patients who engage in high-intensity interval training as part of a comprehensive outpatient cardiac rehabilitation program will show significantly greater reductions in total body fat and abdominal fat, as well as greater improvements in the lipid profile compared to their counterparts who participate in more traditional, moderate intensity continuous training. We thank you for your interest in our study, and if you'd like to read the full article for more details, you can find it in the September 2019 issue of Mayo Clinic Proceedings.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.